This episode of the Operatory podcast is brought to you by Opera VR Digital Nitrous, the immersive patient anxiety melting experience proven to be as effective as nitrous oxide with no drugs. True drug-free sedation with Opera VR. Go to digitalnitrous.com. Welcome to the Operatory, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me today, providing the valuable patient perspective, is my man David Pryor. How are you doing, sir?
Good, Brian. How are you?
Good. I'm doing better after watching you dance around to our funky little theme song.
You picked this song, and I gotta say, it's a compliment, Brian. Get ready. It's really good.
I'm waiting for it. It's good. Wow. Whew. Man, that's a rare thing. Compliments from Dave. Well, today, Dave, I would love to hear what you have to say about what we can do on our side of the table, our side of the chair, our side of the operatory, to help bring back what I remember about going to the dentist as a kid.
Halitosis?
No, I've never had a cavity in my life. And the only dental procedures I had done prior to me graduating from dental school was my wisdom teeth being removed and having my teeth cleaned.
Well, let me introduce you to my friend Mountain Dew.
Yeah, well, you have introduced me to both Mountain Dew and the consequences of Mountain Dew, Dave.
Oh,
That's it's not true. I mean, for somebody who drinks Mountain Dew, you're like the poster child of not having problems with your teeth due to Mountain Dew. And I don't think it's due to your fantastic oral hygiene. So,
wow,
must be your dentist.
It must be, clearly.
Well, so here's what I remember about being a kid going to the dentist. I remember a crappy lollipop that was like, I remember it being red circle with like this little, it was like a loop, right?
Yeah.
And so now I'm like old man Laskin. You know what I'm talking about?
I do know what you're
And there was
talking
like a cellophane wrapper, and it was like pure 100% corn syrup, and it was the best, you know. And then I would go to like this like it looked like I was going into Smog's lair to buy, and there was a chest of like gold coins.
You are nerding out like nobody's business on this podcast.
I was totally bagensing up from this treasure chest, and it was like there's like those frogs that you would like push down and like shoot across the room, right? Yeah. Did your dentist do that? Yeah. So I've been in lots of dental practices today, and there's maybe I don't go in many pedo practices, but I just don't see that type of like experience for people today. Does that make sense?
Yeah.
And so I remember like once I got like one of those little games that it's like the little water thing where you shoot basketball through a hoop.
Yeah.
And I thought it was the greatest. And you know, there's whole industries of companies that buy this stuff from China for 3 cents and sell it to you for 25 cents, right? And that would cater to dentists, and I just don't see that happening anymore. And
is this coming from the dentist who's like the master of every fidget spinner that exists on the face of the earth?
You know, I'm feeling really stupid right now, Dave, because why we didn't jump upon that fidget spinner craze when it was there. Now if we come up with like the Lake Minnetonka fidget spinner, we look like we're
just
5 years too late, right?
Yeah.
No, so I don't even know what that is today because my kids are older and nerdy like their dad. So I don't even know what that would be. Maybe some. I have no idea. But that's what I wanted to talk about today. What can we do to bring back that magic? Because when I liked going to the dentist as a kid because I didn't have cavities, and when I went there, I got this crappy lollipop and this crappy frog. But I thought I had just walked. I was like, I just robbed the treasure from the dragon. I thought it was the greatest, as my nerd stuff comes out. But so, you know, obviously I have some ideas of what you can do to bring the magic back to the dental practice. That's really what we're talking about.
I mean,
right?
But,
so what ideas do you have, Dave?
obviously,
from a
working
patient?
for Opera VR, my first thought is virtual reality sedation.
Yeah.
Because, like I said, I was at a dental conference. I'm flooded with dental conferences right now, with Hinman in Chicago and all the other ones that I'm going to.
Mm-hmm.
But I was just at one where I was demonstrating VR, just sitting in my booth, and one of the people that worked at the conference, it was a server, came up to me and said, "What is that? Can I try that?" And I'm like looking around the room. I'm like, "Do you see like what this does? This person that is working is interrupting her work to come over and wants to try this out." And I'm like, my hands are up in the air. I'm looking around the room. This is what you can have in your practice. You can have something where people are excited to try it. And every single time I have a patient that puts this thing on in these kinds of environments, they say, "This is the coolest thing. I can't wait to try this at my dentist." And then I asked her afterwards, "So are you going into medicine?" And she's like, "No, I'm going to be a cop." Like, so it had nothing to do with dentistry. It had to do with the patient experience. And I'm like, that's exactly our point.
That's yep. You're hitting the nail on the head, my man.
Yep.
Yeah, and that's really what that's a big part of what this podcast is about refocusing our energies onto what changes dentistry from the patient's perspective. Because I just firmly believe that we as dental professionals have had our eye chasing a different, we've been chasing a different ball for so many years, which has been necessary, which is clinical quality, and that's always important. That's always primary. Yeah. But now I feel like we're entering a new phase where our margins are tight, our shades are good. We have to do more. Yeah. We have to change patients' perception on what going to the dentist is. And when I was a kid and I went to that stupid little cardboard box that had a padlock painted on it to make it look like a treasure chest, I had the dentistry being done in that office was probably nowhere near the way the dentistry is done today. There was no CAD cam, there was no CT imaging, there was no, the ceramics probably all broke within 24 hours of being put in the mouth. I'm exaggerating, but what we have today clinically is so much higher, but yet we've got these but there's no lollipops. Well, right?
I remember there were big lead shields that would go on top of me, and clinicians hiding behind a blast barrier.
Yes. So we have improved some patient experiences. That is true. That is very true. Yes, and I think our anesthetics and pain management is much better. So we can focus on what I think are perceived to be the littler things, right? Yeah. But I think those things have kind of slipped off. And you're exactly right. VR's key. I mean, we're really changing we're literally changing their experience or virtually changing their experience, right? When they're in the chair, and that is absolutely huge.
Well, and the other experience that I had at a trade show which was at Chicago, was that, and we posted this on our Facebook page a few times. There was this little kid that was in total meltdown, and I'm sitting there
because he was standing by you.
Obviously that had something to do with it, but I'm sure it was because he was a little kid at a dental conference on a Sunday afternoon. That might have had something to do with it. So he was bored out of his mind, going crazy.
My kids listen to the podcast. Yeah. You're welcome. Never didn't do that to you.
So all that I did with this kid who's in meltdown, I'm sitting there with my VR headset, and I'm like, I know what will happen if I do this. So I just hold my hand out to that kid with the VR unit, and he snatches it out of my hand, puts it over his eyes, and is just engrossed instantly. So it goes instantly from child meltdown to child amazement in 10 seconds.
Those pictures are they're the best. Yeah, because the little kids just and reaching out for the fish, and it's really cool.
And it's super fun. It's Like my job in selling VR, when people try it for the first time, it really is a lot of fun.
Yeah.
Yep.
Yeah, it is fun. Yep. It is. It's great because people don't realize the immersiveness of virtual reality until you actually experience it.
No.
Right.
Yeah, you're
and for
100%.
people, and you were 100%. I mean, I've been just blown away on like Facebook. If we'll put as we've talked about in the past, if we put a Facebook ad out about, getting new patients or increased case acceptance or stuff that's purely like focused on growing your dental practice with VR,
Yep.
all we get are responses from patients.
Yeah.
And I mean, that really speaks to kind of the state of the industry, and how we should focus on creating these experiences where when that kid comes in your practice, right, how can we regain that? I'm not going to go back to giving out the crappiest lollipops that ever were made, because now that I've been in practice for 20 years, I realize that, I don't know, maybe I should. Maybe it's that easy to spend 3 cents on a lollipop for kids. But
It's a liquid form of lollipop. Just have cans of Mountain Dew.
Just have cans of Mountain Dew, exactly. Yeah, that would be horrible. But I do know practices that give out like gift certificates for ice cream cones, and finding a local restaurant or place around you that you can give gift certificates out to go get a treat or whatever afterwards. And that I think that could kind of do the same thing. They still make those treasure chests. You can fill it up with crap. I know that they have like video games you can put in your reception area. There's lots of ways that you can focus on kind of getting that magic back. But I think what was cool about those things when I was a kid was that they were unique experiences to when I went to the dental practice.
Yeah.
Does that make sense?
Yeah.
And so that's what I was kind of wanted to get to for our listeners, is that I didn't have a treasure chest with frogs that jump at home, right? I didn't have those horrible lollipops at home. And if you give somebody a gift certificate to go to, like, the Starbucks next door or whatever, that's nice, but they probably do that already. So focusing on ways that you can have a unique experience in your practice that people only get when they're there, like with our virtual reality product.
Yeah.
We're doing one of the things we're coming out with soon, and probably I'm sure by the time that this podcast airs, is we're allowing people to visit. The first one will be Alaska, right? And then we'll have different categories of videos, and then we're going to actually be seeding the next visit. So today you're visiting Alaska, and we can have facts about Alaska that pop up, and then we'll also say next time you're in, visit Paris. And so we're actually seeding the next dental visit, creating a unique experience, because people don't, when they're at home, they're not like touring places around the world. Right. And so it goes beyond, what we're doing is we're going beyond the anxiety reduction that we've talked about on this podcast a ton, which is huge, and still, I believe, the primary driver of why every practice should have VR. But in Opera VR, what we're doing is we're actually going and changing the experience to be educational, entertaining, and inspirational while they're in the practice, and seeding the next visit. And we've talked before about how we do the post-operative instructions so that you don't have to lecture at people, and really taking that magic back to the dental practice, right?
Yeah.
And so you're exactly right that from our company's perspective, we do that through VR. But there's many ways you can probably think to do it in your own practice. But I would focus on, in your dental practice, creating a unique experience to you that you can provide that they can't get, or maybe they can, but they don't when they're at home.
Yeah.
Make sense?
Oh, 100%.
Cool. Well, thank you very much for providing your extremely valuable patient perspective, which is, as we've highlighted on this podcast, so important to look at in today's dental marketplace.
Thank you, Bryan.
Sure. Thank you. I also want to remind you to rate and review us wherever you're listening to this podcast. If you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of the Operatory. Thanks for listening. I look forward to speaking with you next week.